Hi, my name is Lim Wai Kian, and this is my individual video presentation for medical law assignment. The topic of research is the right of healthcare is a basic human right. However, there isn't any sufficient funds for all patients to receive the best treatment. In view of the difficulty, critically analyze the rationing of healthcare under the National Health Service. First of all, I will be explaining the NHS, the National Health Service. The National Health Service was launched in the year of 1948, and one of the NHS core principles is that good healthcare should be available to all, regardless of wealth. The Secretary of State for Health leads the NHS, working with 5 other health ministers. The Secretary of State is accountable to Parliament for the performance of the NHS and decides how the funds granted by the Parliament to the NHS will be spent. The Department of Health is responsible for running the NHS, providing strategic direction, setting standards, investing resources, and striving for improvement. The Department of Health has defined commissioning as the process of ensuring that the health and care services provided effectively meet the needs of the population. On 1st of April 2013, the Clinical Commissioning Group (CCGs) took on statutory responsibilities for commissioning the majority of NHS services, including urgent and emergency care, elective hospital care, community health service. The National Institute for Health and Care Excellence, also known as NICE, provides evidence-based information for the NHS in England and Wales on the effectiveness and cost-effectiveness of healthcare interventions. The NHS England and CCGs are legally required to make funding available for drugs and treatments recommended by NICE. Is the right to healthcare a fundamental human right? Well, first of all, what is a human right? According to the United Nations Human Rights Organization, human rights are rights inherent to all human beings, whatever our nationality, place of residence, sex, national or ethnic origin, color, religion, language, or any other status. People should be entitled to affordable health care. Article 25 of the United Nations Universal Declaration of Human Rights 1948 states that everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care and necessary social services. The Universal Declaration of Human Rights is noted as the first international declaration of fundamental human rights. 6% of the world population has not received health care. It may sound little, but that is approximately 400 million of people out of 7.2 billion people in the world. In recent years, the slowdown in funding growth and rising demand have made it increasingly difficult for the health service to live within its means. But what are the effects and how can it affect those who access health services? The first one, deflection. The NHS refuses to treat an individual or pay for their care and instead deflects them elsewhere in the system. When this happens, there are 2 ways in which the responsibility for funding or providing care can be deflected in the NHS. Either deflects the patients to another payer, for example, to the local authority or to another NHS organization, for example, from a GP practice to a hospital. For patients, this can create uncertainty and anxiety as they are passed between organizations. This might result in a delay in getting care or in frustration as they have to repeat the same information multiple times. They may get the wrong care in the wrong place from the wrong professional, and in some cases they may be deterred from seeking care or denied treatment. The second, delay. People will have to wait longer for diagnosis and treatment as services struggle to employ the staff or fund the premises and equipment needed to treat everyone who needs care in a timely way. The third one, denial. Patients do not receive treatment because their local health commissioner does not fund it, or their healthcare provider feels it is not appropriate. These decisions are usually based on evidence about clinical and effectiveness. This means denial can sometimes be a good thing for patients if they forgo ineffective treatment, but it can also be a bad thing if they miss out on effective care. The fourth one, selection. Selection is closely linked to denial, but while denial is based on the nature of the treatment, selection is based on the characteristics of the person being treated. In practice, examples of denial often include an element of selection, as there are very few treatments that are denied to all patients in all circumstances. Patients might be denied treatment because they do not meet certain eligibility criteria. These decisions are usually based on evidence about clinical effectiveness of treatments for people with particular characteristics. For example, a GP might not refer an individual for surgery if they are less likely to benefit from it because they are a smoker or are overweight. The fifth one, deterrence. The NHS, either consciously or unconsciously, can put up barriers that make it difficult for patients to find out about or book appointments with local services. If individuals are not given information about a service, they may not realize that their access to care has been restricted. In most cases, if individuals are deterred from using NHS services, it is the unintended result of other service pressures. Whatever the cause, there are examples throughout the NHS of individuals not seeking treatment because they either do not know about or are unable to access the services available. The sixth one, delusion. Patients receive the same basic treatment, but as budgets are cut and resources are spread more thinly, the quality of their care may suffer. This might mean appointments are shorter or less frequent as a service can no longer employ as many staff as in the past. It might also mean that the care pathway changes so certain diagnostics, follow-ups, or other services are no longer included in the patient's package of treatment. Before I end my individual video presentation, I would like to say that lives are precious. The lack of funding does not give a good excuse for those who are in need of medical care. Thank you.